The good news is Rhode Island is faring very well relative to other states, and as I learned from the example of other governors, we are right there at the top in terms of best practices of what we need to be doing in order to deal with the coronavirus pandemic. I'd like to thank you for joining me. This is a very important way for you to get your information, and I would encourage you to really make an effort, especially over the next couple of weeks, to tune in or listen to it later, because each day there's going to be a little bit more information around what's our life going to look like together in the weeks and months to come as we start to relax some of the regulations and stay-at-home order and begin slowly to dip our toe back in the water of getting back to work. A special note, today is at 2:30. Tomorrow we'll be back at 1 o'clock and then stay at 1 o'clock for the remainder. As you can see from the data on the screen, we had another 272 cases today. But you will also see that hospitalizations, ICU beds, cases, although they're not going down in a trend that we would like to see, we're in a very stable situation. And as I do every morning, I check in with the hospitals, and they are feeling comfortable and certainly very capable of dealing with the demand that they have. So it's a stable picture, it's a plateau picture, and it's basically good news in that it validates the steps we've taken in order to protect Rhode Islanders. So I have a lot to cover today, so please bear with me. I want to start today by making a special note about Mother's Day. Mother's Day is Sunday, of course. It's a very, very special day of the year. I know certainly it's a big deal in my house because we so cherish my mother. But this year, it's going to have to be different. And why am I saying that today? Because I've already heard from friends and family who are starting to make plans to have big family gatherings to go visit their moms. And I want to just say this. If I lift the stay-at-home order, which I anticipate I will, and tomorrow I'm going to go through all the executive orders, we're still going to be very limited in the number of people that we can be with in social gatherings. And especially if your mother is older or sick or has underlying health conditions, it's really not a good idea to go race to see mom and bring all your brothers and sisters and your kids, and before you know it, there's 15 or 20 people in the house, and that's exactly what we cannot afford to have on, the first or second day of lifting the stay-at-home order. So I'm asking you now to just plan for it. One of the folks I talked to at the hospital said, I was saying, are you okay if I lift the stay-at-home order and it's Mother's Day? And he said, yeah, just tell people that if they love their mom, they won't go see her. Now, of course, he was joking, but the point is, just get creative. And definitely, if your mother lives in a nursing home, assisted living, if you haven't seen her because you've been trying to stay away from her and she's in communal living, please don't go see her. And I realize that's a very hard message for me to give. And even if she is in good health, just don't get together in a big crowd. That's my ask of you. So if we start planning now, we can figure out a way to love and cherish, respect, and treat our moms. But I'd ask you to remember, we still have to obey social distancing and not get together in big crowds. Okay. Today I want to talk about testing and a little bit more about contact tracing. So, as I've said, in the process of deciding whether we can begin to reopen our economy, we are looking at 6 different factors. And one of those key factors is testing. As we move forward, where we need to get is to a place where we can be testing a lot of people, quickly pinpointing who is infected, get them into isolation, test everyone who they were in contact with, and if any of them are positive, isolate them. That requires a lot of testing, but it's the best way to make sure that we never again have to shut down the economy. I want to make that very clear. That is my top goal, that once we start the process of reopening, we never have to go back to what we've just lived through. I can't promise that will happen. It all depends on our experience and how well people do. But I want you to know that's the goal, and everything we're setting up is to help us achieve that goal. So at this point, Rhode Island is doing very well. We continue to have the highest rate of testing in the country. We were one of the first states to establish the drive-through center, leveraging our National Guard to staff that drive-through center. One of the first states to deploy the rapid Abbott ID testing system, the very first state to partner with CVS on a large-scale operation. And we've also been adding over the past 2 weeks testing sites in communities that have been the hardest hit. Olneyville, the south side of Providence, Cranston, Woonsocket, Pawtucket, Central Falls. This week we're opening again in Pawtucket, Central Falls, East Providence, and Newport. And we will continue to open these testing sites in communities that are the hardest hit and where people have a hard time. Maybe they don't have a car, maybe they can't get to Twin River. I'm also very proud to announce today that we've brought rapid testing to Central Falls thanks to a special pilot with CVS. Once again, CVS is stepping up and coming to the aid of Rhode Islanders. And man, am I proud they're a local company, and thank you, CVS, for once again doing the right thing. So that's a feel for where we are. Now I'm going to take you through where I want to go. So to give you a feel, right now, we're testing about 3,000 people a day. How did we get there? I remember there was a time a few weeks ago, a month or so ago, where it felt like getting to 300 a day. I stood up here and said, we're going to get to 400 a day, and it seemed like a reach goal. It felt impossible. But in the course of a week, we went from 300 a day to 1,000 a day, and then 3 days later, we were at 2,000 a day. Now we're at about 3,000 a day. Over the last 7 days, we've averaged 2,700 tests a day. We tend to have a dip on the weekends, which is something we all need to work on. But due to our hard work and good planning and good partnerships, amazing work by Dr. Alexandra Scott and her team, we've already tested more than 80,000 Rhode Islanders. So to give you a feel, the national average right now in most states, they've tested about between 2 and 3% of their population. Rhode Island has already tested over 7% of our population. So that should give you some comfort. When you're sitting home and you're wondering, how are we doing relative to Massachusetts, Connecticut, New York, and every place else? Where is Rhode Island in this? When it comes to testing, we're doing 3.5 times better than most of the rest of America. And so that should just give you some comfort. Now, where are we going? So today, we're at about 3,000 a day. I'd like to see us at 10,000 a day by July. Now, you might be saying, how are we going to go from 3,000 to 10,000? But that's why I told you we've gone from 300 to 1,000 to 2,000 to 3,000, and we're going to get to 10,000 a day. And then we're going to try to get to 20,000 a day. Why? Because I want kids to go back to school in September. We want colleges to be able to open. That's the goal. I can't promise we're getting there, but that's the goal. That's what we're working for. We're working for the best. And so we got to go from 3,000 to 10,000 by July and hopefully 20,000 by end of September. And that level of testing will allow us to do what I was saying. Figure out who's sick, isolate them, get ahead of hot spots, and start to predict where we might have problems and pinpoint our reaction so that I never again have to say, the whole state shut down. So let me give you a little bit more detail. How do we get to 10,000 and what does that look like? It's broken down into parts. The first part is we need to ensure rapid, reliable, affordable testing for everyone who has symptoms. If the doctor were up here, she'd say symptomatics versus asymptomatics. So that means, here's our goal, from the time you feel sick, the time you get a fever, the time you get a sore throat, the time you don't feel well and you call your doctor, between that time and 48 hours from that time, we want to make sure that you can get tested and get results. So that's our goal for everybody. Widely available rapid testing for people who have symptoms within 48 hours between when you get your test scheduled to when you get your results. Secondly, we want to be able to react quickly to an outbreak. And we've learned, the experience all over the world suggests the outbreaks, if you don't get on the outbreaks either before they happen or right away, then that's when you get into trouble. That's what we have to work hard to avoid. Whether it's at a meatpacking plant, a manufacturing facility, a nursing home, a veteran's home, in Singapore, it was a dormitory-style living of migrant workers. If you don't get those outbreaks quickly enough, that's when the virus runs away with itself. So our plan calls for an outbreak response team on the ground within 4 hours of multiple cases discovered in places like congregate care settings. So that's a tall order, and we're working on it, but that's where we're going to be. So if your workplace, your nursing home, a campus, a school, any other high-density area with a particular focus on communal living, if there's a lot of cases, we want to have a team on site within 4 hours to do the widespread testing and take action. And the team will also then do rapid testing of all the contacts of everyone who is at that facility. Now, I would ask you to just take a second to think about that, because this is not an easy, we're building an entirely new system from scratch. And so let's say you work at a grocery store and God forbid there is an outbreak, or we get there within 4 hours to try to stop an outbreak. It means our team has to get in there, test everyone, do contact tracing, test everyone who's in contact. All positive folks get isolated, and then the rest of us continue to go on with our life. That's the plan where we're trying to be. Finally, we need to create an early warning detection system by testing groups of asymptomatic individuals. So the good doctor would call this a sentinel testing system. Like, we want to get ahead of it. We want to have screening, early warning, and by testing people whether they're sick or not, whether they have symptoms or not. Test lots of people so we know ahead of time that there might be danger. And we know very well that we have to test frequently high-risk settings, all these settings where people are likely to be close together. So, for example, it is our goal that by Monday we will have tested every resident and every worker in every nursing home in the state of Rhode Island. That's an example. We've been working hard at that, and by Monday that will have happened. Now, to be clear, when you do these tests, they only show a moment in time. I could be tested today and be fine. I could get sick tomorrow, tested the next day and be positive. So we are going to have a kind of a continuous testing of high-risk communities, so we always have an understanding of where the risk is. So we're going to do cyclical testing for other high-risk populations on a regular basis. Healthcare workers, first responders, people who live close to one another. And we're going to set up early warning testing sites at high-contact workplaces and other community settings. So what is that? Schools, universities, large private sector employers, and we're working with all of them to set up their own early warning testing for their own population, while we're also going to do representative sample testing continuously to understand what the whole picture is in Rhode Island. This is a lot. This is a lot. It's like nothing we've ever done before. I want you to know we're going to get it done. I have complete confidence. I'm briefed every day. We have an amazing team, They are on it. The National Guard is supporting it. We're deploying a number of state employees who were otherwise, their jobs had slowed down, so we're putting them on this work. Our private sector partners are great. We're in constant contact with schools, universities, our biggest employers, our nursing homes, and we're going to move the system in this direction. Finally, I want to say a word about serology testing, the antibody blood testing. A couple of days ago, Dr. Alexander Scott announced that we were starting our first round of serology testing in Rhode Island. So what that means is we'll be performing both the diagnostic test, the kind of test you would take where you get a swab in your nose to tell you if you have it, with the blood antibody tests. We're going to be doing this initially at 4 Stop and Shop locations across the state: North Providence, Pawtucket, Cranston, and Newport. So for those tests, we're testing whether someone currently has the virus and also whether they have previously been exposed to it, as evidenced by the fact that antibodies are present and built up in their body. Earlier this week, these tests were only available for the employees at the 4 Stop and Shop locations. That was a pilot, and we wanted to roll it out and work out the kinks while we were getting used to it. However, the pilot has gone well, so starting today, the Department of Health is mailing letters to 5,000 randomly selected Rhode Islanders across the state, inviting them to go to one of these 4 Stop and Shop locations in order to get tested, both the blood test and the diagnostic test. Now, I want to be very clear about this. You don't have to do it. If you get a letter and you feel nervous, you don't want to do it, whatever, that is always and always will be your choice. But I'm asking you to do it because it's the right thing for everyone in Rhode Island. You'll get a letter. It'll invite you. It'll offer you a time, like a time slot, that you can go to a particular Stop and Shop, and then the test will be run. If the diagnostic test shows that you have coronavirus, then obviously you will be immediately notified by the Department of Health. We'll ask you to isolate, and the contact tracing process will begin. I do want to make a special note. These are not the Abbott ID rapid tests. This isn't like CVS. This is in the 48-hour category, so it'll take a couple days for you to get results if you're positive. So again, this is something new. It's a thing we're trying, but we want to know what's going on in Rhode Island. Roughly what percent of our population has been exposed to the virus? Roughly how many people have it now? So this is a sample of 5,000. Hopefully most people will show up, and we'll get a lot of data from this. And very honestly, phase 1 is dipping our toe in the water, testing the water, going slow. I'd love at some point to get to phase 2 and move a little faster. This sort of data is going to be so important to give us all the confidence that we know what we're dealing with and we can go ahead and move to the next stage. I do want to also give a brief update on our contact tracing process. So this is the process of figuring out if you've been positive, who you've been in contact with. We have a fantastic team led by the Department of Health. Right now we have more than 100 contact tracers who are reaching out to Rhode Islanders who may have been exposed to COVID-19. I want to make a special note of thanks to the Department of Health. This team started with a few people at the Department of Health and a pad and a paper and a computer tracking people down. It has now blossomed into over 100 people. It's an amazing system. I saw a demo earlier today. It's not perfect. It's still not exactly where we want it to be. You should be so proud of the work that these people at the Department of Health and National Guard have been doing. And to all of you who are on that contact tracing team, honestly, I think you're amazing. I don't know how you've done it, but you've done it. And because of it, you've kept the rest of us safe. So thank you. Where we're going is to make it more tech-enabled, more scalable, and less manual, and we're getting there. So we've partnered with a company called Salesforce. That is going very well. We're pilot testing that this week, and it's just intended to, like I said, speed up the process. Eventually, we're working on a single application. We're calling it like a one-stop app, which will connect Rhode Islanders to information they need about the virus, track their symptoms, allow them to schedule a test if they need to, do the contact tracing process. There'll be an electronic way to keep your activity log, so maybe we can move away from our manual notebooks. I hope to be able to roll that out next week, hopefully. So next week I'll be back with a lot more information about when that'll roll out, what the first version will look like, what future versions will look like. I do want to say this. This is opt-in. You're never going to be forced to do this. You're never going to be forced to give anyone information, even now when the Department of Health calls you. You're not forced to do it. All your data will remain your own. If you choose to turn it over, it will only be at the Department of Health for a limited period of time for specific use for contact tracing. And next week, when we roll out the app, I'll have a lot more to say about that. Okay, I want to move on to business regulations. So I'm moving us towards entering phase 1. And our teams at the Department of Health and Commerce have been very hard at work developing regulations around the new ways that we have to work. All of those regulations will be posted tonight at reopeningri.com. So if you're a retailer or an office business or any business or really any Rhode Islander kind of curious about what phase 1 will look like, as of tonight you can go to reopeningri.com and you'll see the details. To give you, I want to give you a flavor of it and a sense of how we're doing it. I'm trying to balance giving businesses flexibility so they can do their business and keep an eye on their costs with public health needs. So to that end, there'll be certain things which are requirements and then other things which are suggestions or guidelines. Also, for businesses out there, these requirements are not intended to be permanent. These requirements are intended to be in place for however many months that we're dealing with the coronavirus. So the requirements will be along these lines. You have to send employees home if they are sick. You have to screen all employees and find out if they have symptoms, and obviously not let them come into the office if they are. You have to have employees wear their face coverings if they can't be reliably and continuously 6 feet away from their coworkers. They have to maintain 6 feet of social distance. Every employee has to have access to hand washing and hand sanitizer, and there's protocols around cleaning workspaces daily. Those are the bare minimum requirements that we will enforce. There'll be recommended best practices from the Department of Health, and these are intended to help you figure out how to do your business safely, around staggering your work schedules, closing common areas like lobbies, lunchrooms, coffee rooms, and break rooms. All of this will be available tonight on reopeningri.com. You can view the regulations and the guidance. On top of that, there'll be specific guidance sector by sector. And for the retail sector, you can expect to see your guidance tonight also, tomorrow. The retail guidance will be available tomorrow at reopeningri.com. And that's the way we're going to do it. So then when restaurants come online, there'll be specific guidance for restaurants at Reopening RI, hairdressers, etc. Finally, businesses will be required to certify that they've met a checklist of requirements, and that would include developing a COVID-19 plan, explaining how the requirements will be met and how potential cases or outbreaks will be handled. We're going to be providing you with a template. Again, it's intended to help you. Everything that we're going to do is going to be business-friendly in aid of helping you get through what I understand is an enormously challenging time. And by the way, it's in your interest to comply, because the last thing you want is another disruption to your business. All of this is being developed in great collaboration with industry feedback, and we need to be flexible. We are going to roll this out. We are going to do this. If in a week or two we decide we need to make changes, we're going to listen to you, and we're going to make changes. Finally, I want to end on a happy note. Today marks the beginning of Nurses Week. So everyone, and I mean every Rhode Islander, please find a way to express your gratitude to nurses. Today I signed an official proclamation recognizing Nurses Week. I want to say thank you directly and publicly to every nurse in the state of Rhode Island and all the nursing students. Many of you have stepped up to help us, and many retired nurses who've come back to help us. Honestly, I don't know where we would be without you, and I know your jobs have been so difficult, so many anxiety-filled days, the early days of this, reusing the PPE. Undoubtedly, you were stressed out, and so we consider you among the true unsung heroes of this. You've carried us through it, and we're so deeply grateful. And I would just ask every Rhode Islander, find a way to say thank you to the nurses, because if you're not on the front lines of this in the hospital every day or a nursing home, you don't know it. You don't know what they've been living, but it's been rough, and we're grateful for your bravery.